All right. Well, welcome to episode 4 on the community of wisdom seekers. And we have Dr. Tim Warren here to share with us today. And he has 3 things that we can do to look and stay young and feel young. So we're excited about that and really excited to have us have the ability to implement these things. I know stress and anxiety and worry, the season we're in right now, with all the unknowns, can do the opposite. And so I know these tips can be beneficial, not just now, but really long term for the rest of our lives after we get out of the season. So thanks again, Tim, for joining us and bringing us your wisdom. We appreciate it. And the floor is yours, my friend.
No problem. Let me get my screen shared here and see if I can do this the correct way. My understanding is I hit this button here. And that wasn't the one I was supposed to hit, now was it? So I hit this button here, and then I come down here, and I get to share my screen with you guys. Have you made me there it is. So now you should be able to see my screen that says 3 things to do. There you go, 3 things you can do to look and act young again. And I am a doctor. My name is Dr. Tim Warren. I am the owner of Titan Medical Center here in Wichita, Kansas, and I'm a practicing chiropractor. And so one of the things we're going to cover here today, these are all things that we have in our office available to our patients and to you if you want to come in and learn more about them, or you have questions. My contact information will be on the very last slide. So let's get going through this. There we go. So what is aging and how do you define it? Biologically, scientists have found that chromosomes in our cells progressively shorten each time they cell divide. So every time a cell reproduces because it dies or does something else, it has a chromosome, which is partly DNA inside of it, and that DNA shortens over time, and eventually it dies because it can't become any shorter. I'm sure you guys have seen the advertisements on TV talking about your telomere length and that type of stuff. That's a way of measuring your chromosomes that are there. However, one of the things that we do know is, let's say that you have absolutely phenomenal telomeres. That doesn't mean you're going to live forever. That could mean that God could take you now, God could take you tomorrow, God's going to take whenever he wants you, no matter the length of your telomeres that are there. However, I believe in doing everything that I can to stop my aging process, so not only do I maybe hopefully live longer, but I have a better quality of life as we go on. Okay? So what happens when our cells actually divide and become damaged and shorten and that type of stuff? Well, they go into something called ischemic freeze. Ischemic freeze is where the cell damage has been caused by the lack of blood to it in most cases, or oxygen to be more specific. The chromosomes shorten due to this ischemic freeze, and they lose the ability to communicate with the cells around them because every cell communicates with the cells next to them, and then next to them, and then next to them on down the line. And so as these shorten and ischemic freeze takes place, it's kind of like having a phone number that's disconnected or a line that's down. The cells further down the line get damaged associated with that until you go to another area where it has a blood supply come in that supplies that area with the blood and the oxygen that it needs in order to be able to shorten or lengthen, or reproduce and replace the cells that are there. So that's what aging is. And we all know that person that looks 90, that's 25 years old but looks 95. We know that person is in his mid-70s that looks 40s. So part of that's considered aging, which is normal to the process, and part of that is premature aging. So what is premature aging? Premature aging is when the cells divide, or they age, or they lose the telomere length, they lose the chromosomal length prematurely over time. Some people age faster than other ones, that type of stuff. Some people age slower because their chromosomes don't damage as often. So what are the causes of premature aging? Well, premature aging is anything that makes a cell age faster than what it's biologically designed to do. Stress is a huge thing that makes people age. Don't think so? Look at all of our presidents. All of our presidents usually going with some type of like brown hair, black hair. They come out gray. Look at President Obama. President Obama went in with a full set of black hair, came out with a full set of gray hair. His face looked like he'd aged 40 years over that 8 years that he was there due to the stress that he was under. And the stresses that are there: smoking, chemicals, eating improper foods, not getting enough sleep, drinking alcohol, taking illegal drugs, taking prescription drugs, taking vitamins. All these things can cause premature aging based upon what happens inside your body. We all know that there's a Ponce de Leon chasing the fountain of youth. Never found it. He died a premature death because he was looking for the fountain of death, fountain of youth. So it kind of happens the same way here. We have all these things on the market that are supposed to make you look younger, make you feel younger, but they're all typically chemically induced and don't do anything inside the body itself as far as healing it goes. So we've already covered what refers to slowing, preventing, and reversing the aging process. This is what anti-aging is. Anti-aging is stopping all the things that you put in your body, all the damage that's been done, and hopefully reversing it where you live longer or live a higher quality of life. For example, an example of anti-aging to its extreme is somebody who has a knee that's been damaged and it becomes arthritic over time. They have it replaced by an artificial knee. Their quality of life goes up, therefore they're able to go out and do more things. That's an example of extreme anti-aging, okay? What we're going to talk about today is there's 3 ways in my practice that we use to help patients with the aging process. The first one is something called the hyperbaric oxygen therapy. Second one is diet and weight loss, and third one is posture. Probably the one of these that you don't think about very often as being anti-aging is the hyperbaric oxygen therapy, because most of us don't know what hyperbaric oxygen therapy is. I was introduced to hyperbaric oxygen therapy 4 years ago, right about this time. I had a middle son, had a brain tumor, had it taken out, and he has some complications associated with it, but that wasn't why I was introduced to it. My mom lives in Joplin, Missouri, and I have a friend over there, Dr. Stephen Skaggs, who does hyperbaric oxygen therapy in his office. And my mom was telling Dr. Skaggs, who I went to school with and I'm friends with, about Caleb and going through the surgery and that type of stuff. And he goes, well, one of the things we need to do is get Caleb over here and get him put in a hyperbaric chamber. That way we can help with the brain damage that was done. So, you know, it's my kid. You'll do anything for your kids. So my wife loaded him up, drove him to Joplin, and they were there for 2 weeks. He went through 2 weeks worth of treatment at Dr. Skaggs' office, and he was a godsend. And he came back a different person than what it was when he went. Had he recovered fully? No. But he'd made enough steps where I could see that this was something that I needed to add, not only for my son, but for myself and my family as far as making sure we have these things. And so that's how I was introduced to hyperbaric oxygen therapy. So let's go through what it is. Hyperbaric oxygen therapy, or HBOT, is a treatment which is used, a person breathes either 100% oxygen or ambient air, depending upon what you're treating them for. 95% of the time in my practice, we use 100% oxygen as we get out of the air. Oxygen is a controlled substance unless you produce it from the air, and we have a machine that does that for you, while being exposed to increased astronomical pressures. The origin and development of hyperbaric medicine is closely tied with the history of diving medicine, and the first document of HBOT actually precedes the discovery of oxygen itself. In the 1600s, a British physician and priest, Nathan Henshaw, developed an airtight room called a docilium. I hope I'm pronouncing that correctly, in which variable climatic and pressure conditions could be reproduced. He did the pressure by using a large pair of billows that actually sucked air out of the room or put air in the room, depending on what he wanted to do. Since Henshaw's time, hyperbaric chambers have actually come a long way. Advancement in hyperbaric medicine and clinical research in the field continues to demonstrate countless benefits for HBOT for patients. HBOT has traditionally been used to treat cases of decompression sickness in divers. That's usually what most people think about, is divers come up and they have the bins, which is nitrogen in the bloodstream. It hasn't all bled out. And it expands and causes them pain, joint pain, that type of stuff, can even cause death, depending upon how severe it is. However, it has shown phenomenal results in assisting in wound repair due to cardiovascular accidents, strokes, heart attacks, burns, diabetes, and crush injuries. In my practice, I've probably had 10 patients, maybe 15 patients that have had strokes in the past that are coming in or have come in and got HBOT therapy. In cases of a stroke, the results are phenomenal because you can see the damaged area of the brain getting the ischemic freeze taken care of and those neurons starting working correctly. And because the neurons start working correctly, the person starts to be able to talk and that type of stuff better, or have better hand movement, arm movement, depending on what's going on. In fact, you guys know who Edward Teller is. He was the founder and the father of the hydrogen bomb. In 1992, he had an example of anti-aging that I used, which was the knee replacement therapy done. Didn't heal very well. So he had a friend who told him about wound healing with the hyperbaric chamber. So he said, I've got nothing to lose, so I'm going to go do this. So he went and did the hyperbaric chamber, and his knee healed exquisitely well, in his words. And not only did it heal exquisitely well, he started noticing certain things, like he had more hair than he had before. The color of his hair had changed from the gray back to the brownish black that it was before. And he felt like his mental acuity had gone up. And so, if it's good enough for him, the father of hydrogen bomb, I think is probably good enough for me. In fact, when he died in 1995, he was still using HBOT therapy to help his mental acuity, and he was still going to work every day at Lawrence Livermore Laboratories as the head of the research department that was there. So apparently at the age of 92, he hadn't done very bad. Okay, in modern times medicine, this therapy has been proven to offer anti-aging benefits through healing and regrowth of damaged cell. Hyperbaric oxygen therapy, or HBOT, or HBOT, the person breathes 100% oxygen while the pressurized in the chamber is increasingly slowed. Pressurized oxygen is delivered to the chamber, which increases the pressure of the oxygen within the person's body to as much as 15 times normal tissue saturation. Each cell is literally saturated with 100% pure oxygen and accelerates the body's natural healing processes and the anti-aging effects thereof. By doing this, it makes it where you can do mental acuity gets better. I've got a patient now who was my number 2 patient ever in practice. When I first started back in practice in 1994, he was the second guy that came and brightened my day. He has had ankle problems. He tore his Achilles tendon about 15 years ago, had surgery, didn't go well, had surgery, didn't go well. They ended up fusing the ankle and wrapping it around that way. And it was causing him constant pain. And so one day I'm talking to him and I go, "Hey, John, we got to put you in the hyperbaric chamber." He goes, "What is it?" So I took him over to it, showed it to him, and he goes, "What does it do?" And I told him it makes your body basically 100% oxygen carrying. Therefore, it takes the areas of damage that's there and oxidizes them, makes it where the cells come out of the ischemic freeze and they start working like they're supposed to again. By doing this therapy with him, his pain level has dropped from an 8 or a 9 every day to a 2 or a 3, and most days it's actually a 1, depending upon that wonderful Kansas weather. So we know that it accelerates the body's natural healing processes, and we know that oxygen is used to help the body's antioxidant defenses. It boosts metabolism, counteracts low oxygen levels that lead to sluggish cell activity and oxidative stress. Research has shown that it can help improve the efficiency of hemoglobin in transferring oxygen around the body, improve blood flow by helping keep the cell membranes flexible, suppresses inflammation, which is what we're fighting when it comes to anti-aging, detoxify and fight infection by destroying bacteria, viruses, parasites, and fungi that live or thrive in low oxygen environments like most of them do. Okay, our focus today is anti-aging and living a higher quality of life. Hyperbaric oxygen therapy is an outstanding all-natural therapy with 0 side effects that will help you look and feel your best. There is no other anti-aging therapy that is effortless and so effective. You literally get put in the chamber and you get to lay there for an hour and read a book, play on your phone, sleep, those types of things. So, did I miss a slide? Yep, I did. Hyperbaric oxygen therapy focuses on the health of the body as well as the health and beauty of the skin. Applications of the HBOT include skin and body rejuvenation, anti-aging, skin toning, banishing cellulite, wrinkle reduction, detoxification, stimulation of the immune system, longevity, anti-inflammatory, stem cell proliferation, and weight loss. Okay, last fall I had shingles that attacked me on the right side of my face. Painful as all get out. I am fortunate that we had the hyperbaric oxygen treatment. I did it almost every day for about 3 weeks, and my healing time was cut to about 2/3 of what the normal healing time is for somebody. I'd still have some scarring, but it's getting better with the use of the HBOT therapy. Okay. H-bond oxygen therapy, there's an overall increase in healing effect because H-bond increases blood supply. In some patients, even observed increased cognition, behavior, and neurological function. It can stabilize damaged blood vessels in the inner lining of the blood cells, promote the growth of new blood cells, and reduce chronic inflammation. All these benefits lead to anti-aging. The second one we want to talk about is diet and weight loss. Diet and weight loss is something that affects 2/3 of Americans, whether you're overweight or obese. We all know that being overweight causes heart attack, high cholesterol, diabetes, increased arthritis, joint pain, sleep apnea, and certain types of cancer. One of the least talked about aspects of obesity or even being overweight is the wear and tear in our joints. The joints show excessive wear and tear when they are required to carry extra weight. Even small amounts of weight changes can make a big difference between joint forces in our hips and knees, and it increases about 3 times the weight that we are walking normal with. That means if we're carrying 15 pounds of extra body weight, that means our knees feel roughly 45 pounds of extra weight every time you take a step. So if you're the normal person trying to get their 7,000 steps in a day, 7,000 times 45 is what? 31,500 extra pounds your body's taking every time throughout the day, every time you walk, up on your knees and your hips and that type of stuff. So anti-aging is also the quality of life. And so if you have bad knees, bad ankles, bad hips, you don't get to go out and enjoy things with your kids, your grandkids, that type of stuff. And so one of the things we can do for anti-aging is diet and weight loss. We have a phenomenal weight loss program that we use in our office that we get phenomenal results with patients that follow like what we want them to. Okay. We also know that the chances of developing arthritis is strongly associated with body weight. Yes, there are thin people with arthritis and heavy people with healthy joints. But overall, the chance of developing arthritis in your joint is strongly associated with your body weight. People have a high body mass, BMI, tend to get arthritis at a younger age. You know there is a connection between good posture and weight loss as well. Posture is the third thing we want to talk about tonight. Research shows that your mother was right. Even posture when standing up straight, as shown by a new study, finds that people who have better posture really are healthier, usually live longer lives. Not only is it intuitive reasons why people with good posture are healthy and more active, but poor posture has dramatic effects on growing problems facing older adults, which is falls and poor balance. Research has shown that poor posture may increase feelings of depression, affect your digestive tract, and influence your confidence and stress levels. In fact, the American Posture Institute released a study about 2 years ago, and they talked about lung volume and posture. So I have something I want you guys to do. Tip your head as far forward as you possibly can and take a deep breath. Okay, now return your head to normal posture with your head upright. Take a deep breath. Which breath was easier for you to take? The one with good posture. And as I always tell my patients, how many trees that grow sideways are healthy and live long? They don't. Any tree that grows sideways usually falls to the ground and is destroyed quickly. So with posture, here's some of the benefits of it. Appearance benefits with good posture are obvious, but many less obvious health benefits you should know about. Good posture, such as maintaining correct alignment of bones and joints. By doing that, it reduces the stress in the ligaments, minimizing the injuries. You know, in basketball, volleyball, and those types of sports, we can actually predict who's going to get injured and who's not to an over 95% degree of certainty by measuring their posture and Q angle of how healthy their lower extremities are. Prevents muscle strain, overuse, and pain. Conserves energy as muscles are used more effectively. Decreases abnormal joint wear. Something else to look at. We know for a fact that Olympic athletes perform better when they have good posture. How many Olympic caliber athletes do you see with poor posture? How many NFL athletes do you see with poor posture? How many NBA players do you see with poor posture? None, because they get paid to take care of the body and prevent the anti-aging of it, and they know that posture is one of the most important things that they can do. Okay, these three things when used in conjunction will help you slow down the healing process, but will also improve the quality of your life. You guys have any questions at this time?
Awesome. Yeah, I did. I was going to ask if you'd been in the chamber and your experience. So you did share that with us already. Um, I think really more than anything, I just was curious about the chamber and just the effects and how it works. And now that I have more understanding, I remember having bronchitis when I was in high school, really bad, and I was delusional. Like I was not able to think clearly. So I know what it feels like not to get oxygen to the brain, and I would totally agree with getting more to the brain. And I always tell people it has such a healing. It's our freest. It's a free resource that has the most healing power as far as just what we have access to. A lot of times, just breathing more effectively helps. So I can't imagine what it's like to have that chamber, work on me. Now that being said, I know you sent me a little bit of a graphic where it was like typical oxygen, when you're normally breathing, and then what it looks like when you're under the hyperbaric situation. Can you give us that analogy? Do you have that?
I don't have it on this computer, but the analogy I sent to you was basically your normal breathing, you're driving around a Yugo, if you can remember a Yugo.
Mm-hmm.
There were the cars from the early mid 1980s that if you bought one, you got one free for the spare parts. They were made in Yugoslavia. I know it's a really bad analogy since nobody knows what it is. I'm dating myself horribly bad. And by being in the hyperbaric oxygen therapy treatment or in the chamber, it's like driving around a Maserati. Your body works better. It has more oxygen associated with it. Here's another way I equate it to patients is I drive a Ford Escape. Love the little car. If I put diesel in the car, would it run normally? It would run, but it would be really, really sluggish.
Right.
That's like trying to breathe the quality of air that we normally have in this world because we have dust, we have chemicals, we have all these different things associated with it. By doing the HBOT, it's like putting super unleaded in your car. It cleans everything out and everything works like it's supposed to, and you just feel better. Your car performs better, you get better gas mileage, those types of things come along with it. Along those lines, we have a young lady who daughter has cystic fibrosis. And about a year ago, she complained about she's 3 years old now, she's 4 now. She had a dry cough all the time. And this is a young lady that my family's known for years. And so I said, well, why don't you bring her in? We'll put her in the hyperbaric chamber with you. And so she does. And she says, as long as she came in and got the hyperbaric chamber done, the dry cough went away. And with cystic fibrosis, you always have a dry cough because the lungs just don't work correctly. They don't oxygenate. They don't transfer oxygen across correctly. And because of that, she was able to get better night's sleep and that type of stuff. So that's kind of what it works like. It's kind of like trying to breathe in a chamber that doesn't, in the normal world, and then go breathe pure oxygen at high pressure.
Now, what about the benefits for somebody that is healthy? I know I'd mentioned, what if somebody, I said, this sounds like it's good for people that have that. Let's talk to that market. But then you said, well, actually, somebody like you would really benefit from this, using it more consistently at your age and with your health. So can you explain the benefits of a healthy person using it?
Yeah, just like anything you do when you eat healthy foods, that type of stuff, you put healthy and you get healthy out. The air that we breathe is so polluted these days with car exhaust, chemicals, secondhand smoke. The things that we do in our body, we drink pop, we drink diet pop, we drink, Wichita water. I live in Hayesville. So imagine drinking Hayesville water and having that go through your system. The hyperbaric oxygen therapy actually goes through and cleans out that stress that's put on your body by the excess chemicals to make it to where the aging process is delayed. And it kind of goes through and cleans all that gunk out of your body and lets it work like it's supposed to. Not only for the brain, but for the body itself as it goes along, because the oxygen and blood will actually perfuse throughout the system. And you actually get up to about 100% PO2 rate, which is incredibly good with oxygen.
So I did pull it up here as far as the comparison. It's this oxygen molecule horsepower is what it's called. And it's 27.3. And then that's with ambient air. Is that what that is?
That's with ambient air, yes.
Okay. And then with being in the chamber, you're at 130 plus is what I'm seeing. So can you explain a little bit of what that means?
Yeah, when you breathe oxygen in now, the proliferation rate as it goes into bodies is lower than what it is when you're under pressure with pure oxygen going through. We see people walking around with the oxygen bottles on, and that's just to keep their PO2 level a certain rate. It's non-pressurized, therefore it's not being perfused through the system like it's supposed to be. When you're under pressure in the chamber, it perfuses in the system, gets in the lymphatic chain, gets in the lymph fluid. It basically makes any fluid in your body 100% oxygen saturated. And by doing that, it's able to increase the cellular production and the horsepower of the cells as they work through.
Awesome. Very good. Cool. Well, those are the questions I have, and I do understand how all three of them work together. That was the one I was most interested in, definitely with just what we had talked about the other day. And obviously, you know, diet and exercise. I know that that can be so beneficial for so many, especially with how many really need it. And then obviously posture. It's just something that's interesting. You know, think about. I know for me, as growing up as a young athlete, that could have prevented a lot of different issues I had I been seeing somebody that was getting me in alignment. It just wasn't something I had awareness on or was really told I needed to seek. And now as I've gotten older, I've realized the importance of it and how much it can prevent. So I really
and now
appreciate
imagine going back when you were younger and being able to get access to these things. You think you'd have some of the aging problems you're having now if you would have had access to them when you were 15, 16 years old?
Right. No, I have lower back issues that pop up occasionally, and I know my hips and knees and ankles aren't right.
Mm-hmm. And that's exactly why when we were talking originally, I said the younger you are, the better off it is for you.
It's true.
I love the fact being that my family uses the hyperbaric chamber regularly. My family gets adjusted regularly, and we do posture exercises with my grandchildren, but they have good posture as they grow older.
So how often do you recommend somebody to be using that chamber?
You know, it depends upon the person. It's kind of an individual case basis. Mm-hmm. Somebody I'm 56 years old. I've had some concussions. You know, I didn't make smart choices when I played football when I was younger. Been in a couple of car accidents, that type of stuff. I try to get in the chamber as often as I can. The only problem is, just like being the chiropractor, how often can I adjust myself? You can't. And so I'm kind of at the mercy of my wife coming up and doing it with me. And my wife is phenomenal coming up and doing it. However, you have to be certified and that type of stuff to be able to do it. I try to get into it at least once a week. I wish I could do it more. When we had it at home for my son to use, I was using it on a daily basis. Mm-hmm. And it's amazing how much better I felt at that point in time.
Mm-hmm. Cool. Well, that is all I have for you, Tim. I really appreciate you and your time and all of your wisdom that you shared with us tonight. And we'll go ahead and end the recording. Is there anything else you'd like to say, ways that people can contact you, reach out to you?
Yep, I'm the owner of Titan Medical Center here in Wichita. Our address is 1415 West 31st Street. Phone number is area code 316-529-3700. Website is www.titanmedcenter.com. Our email is office@titanmedcenter.com if you have questions.
Perfect. Thank you once again.
Thank you. Have a great day.